today. It's Deb and I here to address your questions, part of the Texas Health Education Service initiatives that we have here. My name is Enrique and Dr. I'm the Associate Director of the Texas Health Education Service, and Dr. Beck is here joining me today.
Hello, how's everyone out there?
And Dr. Beck, would you mind sharing your role with our organization and some of your experience as well?
Sure, I'm the advising coordinator for the Education Service, and I was previously, for about 18 years, the director of the advising office at the University of North Texas.
So we have quite a bit of experience between the two of us and different aspects of the application, the preparation process. So at this point, we've done quite a few CURD sessions with the member institutions for TMDSAS, and we wanted to take this opportunity to kind of answer any other questions that you all may have, synthesize some of the feedback that we've heard from the schools, and also walk you through some of the resources that we have provided that are new this year. And so I think that's where we're going to go ahead and get started. But just as a reminder, this is a live Q&A. So if you all have any questions for us, submit them on the TMDSAS or Texas Health Education Service Facebook pages, and we will keep an eye out for your questions so that we can address them in this session. So if you have any question about the application, the preparation, if you are a couple of years away from applying, if you are a super gung-ho middle school student who would like to become a doctor, and you have some questions for us, nothing is out of the range of what we can answer today. So, and don't fret. This is a no judgment zone. I do want to emphasize that everybody had to start somewhere, and we are very happy to be here to help you along your journey. So first off, what we wanted to do today is walk you through some of the new resources that we have on the Health Education Service website, as well as the TMDSAS website. One of those is, and let me share my screen here, that is the newsroom that we have on both websites. And so on the Texas Health Education Service website, if you scroll a little bit further down, you'll see that we have some news articles that are published here. And just to show you where those appear on the TMDSAS website, the same concept. If you scroll down a little bit further, you have some additional articles that appear here. And so today I wanted to discuss two of the articles that have come up recently. And these are based off of feedback that we hear from TMDSAS, from our advisors, and from members of our Facebook groups, the TMDSAS Hub and the TXHES, the TMDSAS Non-Traditional Students Facebook groups. If you are not a member of those groups, I highly recommend that you join. These are groups that we manage carefully. We have moderators in there who are advisors for the health professions from a wide variety of institutions throughout Texas and outside of Texas, as well as some admissions officers from our professional schools. We have folks from TMDSAS, and they are all in there helping us moderate so that any questions that you all have, we're able to make sure that the answers that you're getting are factual and accurate. I know there's a lot of misinformation out there, and we do work really hard to make sure that the information that you get from us is helpful and relevant to you. And most of all, that it is factual, because things change really rapidly in this environment. So first off, I wanted to go over some of the articles that we've written based off of the feedback. The first one is on entering your coursework in the TMDSAS application. We talked to TMDSAS about some of the phone calls and emails and messages that they receive on their end. And there's a common thread about some of the issues that a lot of our students face in this section of the application. We do have a video for you all if you'd like to take a look at that. In this video, we go over, and I won't play the audio because it's myself and you would hear me twice, but in this video, it's really helpful because we'll actually go through the overall coursework section, how each one of the sections of the application, the questions within that coursework section, and then over later, we actually have some sample semesters that we pull from a sample transcript, and we actually show you how to enter those in the TMDSAS application. So that's a really helpful video. If you're brand new and you kind of want a quick view into how entering the coursework would look like, or if you might be a few years away from actually starting your TMDSAS application. So some tips from TMDSAS is to read the handbook. A lot of questions that we get are already answered in the handbook. So please do take the time to familiarize yourself with the TMDSAS application handbook. It's a really great resource and walks you step by step into how to enter everything in your application, considerations for you, and it outlines any requirements of you as an applicant and expectations of you. For entering your coursework, of course, you enter the area, your prefix, the name, and the number has to match what's on your transcript. And the way that you do that is you pull an official transcript to have as a reference for you to fill out the section. If you've attended multiple institutions, obviously you want to have multiple or a transcript from each one of those schools, and enter everything just as it appears on your transcript. Now, in the TMDSAS application, there is a section where you enter a course area, and they've created the resource of the course listings to help guide you through that. So what the course area is it asks you to determine whether it was like a biology lecture or a biology lab, biochemistry, a physics course, English course, and those are based off of the different prerequisites for our dental, medical, and veterinary schools. And based off of those, the courses that TMDSAS has encountered previously, they include in the course listings pages. So if you are interested, take a look at the course listings for your school. Now, this list is not conclusive. It continues to grow as we see different courses. And there are some schools that we may not have seen yet and may not be represented in the course listings. That does not mean that it is not a course that will fulfill the prerequisites. In those instances, please just do the best that you can in filling out that section, and TMDSAS will verify based off of the information that you've provided that your course is placed in the correct area. And this is important because it's one of the ways that GPAs are calculated in the TMDSAS application. And we've discussed several times in other current sessions about how many different types of GPAs are calculated by TMDSAS. It's incredible just how many things, how many different ways those GPAs are calculated. We have them by semester, we have them by type, BCPM GPA, overall GPA, science GPA, non-science GPA, undergraduates GPAs, graduate GPA, post-bac GPA, a GPA for your fall semester that's based off of just BCPM courses. It's split up in so many different ways. And so it's important that you code your courses and enter them correctly so that when TMDSAS goes through processing after you submit, they're able to verify that the courses are entered correctly and that your GPAs are calculated correctly. And you're able to see these in your application. If you go in and download the PDF version of your application, you're able to see all of your coursework and how you've coded that coursework. And so take a look at that and include it in your revision for your application before you submit. For AP credits, just make sure that any AP credits are included as pre-freshman or PF. And if you have lump sum credits, meaning that all of your AP credits came in a one lump sum, we do have to have a letter from your registrar itemizing how those credits were provided for you. So if your school provided a lump sum, the registrar does need to write that letter. And if you have courses that are in credits or units, there's a conversion chart on the back of your transcript. That's another good reason to have an official transcript on you. And once you've submitted, take a look at your PCR, which is your prescribed coursework report. This report will only take a look at which courses will fulfill the prerequisites for the school type that you've applied to. And it won't list every course. It'll only list the courses that fulfill each of the prerequisites. So this is a quick way for you to see if you have any deficiencies or if you have any courses that maybe not maybe fulfilling some of the prerequisites. If you see that there's a discrepancy on there, there's an opportunity for you to catch that early on and inform TMDSAS. And so this is a really helpful resource, and we hyperlinked to some of the pages on the TMDSAS website that can help you out with this section. Another area that is of huge concern for a lot of our applicants is the activities section. And so in the activities section, obviously you have 300 characters that allow you to discuss that activity and the amount of hours and what you've taken away from those activities. There are also 3 top meaningful activities that you can enter in your application, and that would grant you an additional 500 characters to discuss that experience. And this is important for the schools because it allows them to see what is the most meaningful thing that you've encountered. And it doesn't necessarily have to be something healthcare related. Something I always share with students is that if it's something that's important to you, it's important to the schools. So take some time to really think about what that meaningful activity is and use those 500 characters to really describe, not just reiterate what you've already said, but discuss why that activity was important for you and your development. Another question we get a lot is about when an activity goes into the planned section and when it's a current activity. We use the application deadline as the cutoff for whether an activity is a current activity or a planned activity. So let's say if you are involved in your, Dr. Beck, can you give me a random organization that you can think of off the top of your head?
Sorry. Yes, of course, Alpha Epsilon Delta is the National Pre-Health Honor Society. So that comes to mind.
Yeah, so obviously if you're inducted to that honor society, you would be involved now through, say you graduate next year. And so from now to October 30th, which is our application deadline, you would include it as a current activity, and everything beyond October 30th, the deadline would be a planned activity. So if you have, volunteer service activities that you'll be doing with them, that would also be a planned activity if it's after October 30th. So really just use that date of October 30th to separate whether it's a planned or current activity. I know that TMDSAS specifies that each activity can only be entered once, but that's per section. So if you have a planned activity that is also a current activity, you can enter those twice because they fit into both sections of the application. Here are the different TMDSAS activity categories for those of you who may be applying in a couple of years, just to give you an idea of what those are. And we do have some descriptions on what each of these different activities encompass, what a healthcare activity is, what a animal experience is for those of you who are veterinary applicants, what it means for something to be extracurricular or leisure. And we've also included some guidance on entering your activities. And ultimately what's important here is that you're the one that knows your activities best. I know it's difficult to figure out which category matches your activity, whether it be a volunteer experience or a healthcare experience. You have to enter it in the one that it fits the best. And so your activities best, use your best judgment in this section, and just make sure that you're not entering activities in multiple areas. There is an instance where activities can go in 2 different sections, and that is when something is a healthcare activity and an employment activity. That is the only instance for dental and medical applicants where you can enter them in both sections. Now, even though these will go in both sections, I highly recommend that you write different descriptions for them according to the category that they belong. So for example, if you are a scribe, you want to include that in your healthcare, but in the description of healthcare, you might want to talk about the different things that you may have seen or experienced within the context of healthcare. Whereas for employment, you might talk more about the office culture that you experienced and what you learned from them. And so we have some guidance on here about how those 2 activities work. And then another big question that we get is if an activity is asynchronous, meaning that, say you participated in Habitat for Humanity each June since you were in high school, and you only do it for a couple of weeks in June, which is really helpful, but it's not something that you've participated in throughout the year. You have 2 options to enter those. You can either enter them as an individual instance every year. And this is a great example because there is such a long gap between activities. And this is especially helpful if your role has changed over time. So if your first year might have been, you know, you're just a member, and then in the last year, you're actually like one of the construction leads, that role's been evolving. So you might want to enter that according to each instance. Whereas if it's if you enter it as a single activity, you want to be careful not to overinflate the hours and make it seem like you were involved in that activity over that entire time. So you definitely want to use the description to share how many hours you actually were involved. And so hopefully this is a great resource for you all filling out the application right now. I know these two sections are a little bit confusing, but you know, just do the best that you can in your application. The schools are not trying to trick you with the different sections of the application. They just want to provide some guidance on how the structure of the application works. So we've gotten a few questions here in our feed, so we want to make sure to take some time to address them. The first one is, how are post-bac and master's level GPAs calculated? That's a great question. They are calculated just as every other GPA is. We have overall GPAs, BCPM GPAs, science and non-science GPAs, and those are calculated at the post-bac and graduate levels as well. And so there are, I believe the last time I counted, a little bit over 30 different types of GPAs that TMDSAS calculates, and that's not even taking into consideration the semester GPAs that are calculated. So there are so many different ways that TMDSAS calculates it. So for those of you that try to calculate your own GPAs and come in and see that it's a little bit different for TMDSAS, just know that it's calculated in a lot of different ways. This is why we hear from so many of the schools that they keep an eye out for the different trends in your GPA, because they're able to see that really easily based off of the data that TMDSAS sends them. So they're able to filter out, what does their science GPA look like over time? What does a BCPM GPA look like over the past 2 years? How does dual credit come into play in their overall GPA? So all of those different ways that GPA is calculated allow the schools to be able to take a look at that at a glance. So on your end, what you need to worry about is to make sure that your coursework is entered correctly, and that your the prescribed coursework section, prescribed course report rather, actually shows which courses fit the prerequisites that you entered. Another question, this is from the TMDSAS page. My transcript lumps the total sum of AP credits. How is it recommended to input those courses? That's a great question. You will have to get a letter from your, you'll have to get a letter from your registrar that will show how all of those courses are itemized. And based off of that, you'll enter those in your application as pre-freshman courses. And so unfortunately, you're gonna have to wait to get that letter so that you know how to enter those into the application. And then when that letter is received, send it over to TMDSAS along so that they're aware as well. Okay.
Enrique, let me ask you to reiterate on the post-bac courses or the graduate courses. Are those averaged into the overall GPA in case someone is trying to improve their GPA?
So yes and no. When we calculate overall GPA, that would include any undergraduate, graduate, or post-bac coursework. When we're calculating undergraduate GPA, any undergrad coursework along with post-bac coursework would go into the same GPA calculation, but graduate level coursework would not. Yeah, that's a great question. And again, there are just so many different ways that GPAs are calculated. I could create a list of all the different ways, but yeah, just know that the system does do a great job of showing how your GPA evolves over time. And that's what's important for the schools to see.
That actually shows up on their profile page.
Mhm.
So it's all there together on the second page of the profile page.
And it's not like we're trying to hide any of this. When you pull up your application on the portal on your end, you're able to see some of the different ways that the GPA is calculated. You're able to see your BCPM GPA, your overall GPA, undergraduate, graduate GPAs are all appear on there. And then in the PCR, you're able to see your BCPM GPAs based off of the different prescribed coursework sections. So for example, biology, you're able to see the biology GPA on there. And then of course in your application, there are different GPA calculations on there. Ooh, we could be on that for a while, just talking about GPAs. All right, we have another question about AP courses. I don't believe my AP courses are lumped together, but I did receive AP credit for some college courses and not a grade. Would I still need a letter? You would not in that instance. What you would need to do is reach out to the original institution that granted that credit and get the transcript that shows how that AP credit was claimed, and then enter it in the TMDSAS application as PF, pre-freshman coursework. And then having that credit instead of a grade, that's fine. Just enter it as just credit, and it's one of the options along with a different grade in the application. Okay. So we do have a few more points that Dr. Beck and I wanted to discuss with you all today based off of some of the common questions that we've been getting. But just as a reminder, we're here to answer your questions. So please continue to share those with us and we're happy to address them. Dr. Beck, did you want to discuss some of the feedback that we've received based off of how applications have been affected by delayed MCAT or DAT tests?
Sure. Of course, the TMDSAS application deadline has been extended, as everyone may have noted on the website or through our Courage sessions. So that gives you about an extra month to get things in order and to get your test scores back. In the case of MCAT, in case you've been thrown into that later MCAT test category. And of course, some of the activities and shadowing that you may have planned for this summer may not have happened. That means you may have to have plan different activities, maybe some online volunteering activities or getting involved with your food bank and helping load in food for people who are hungry. It may be, reading to your niece and nephew over Zoom sessions and making sure that they're keeping up with their schoolwork so they won't fall behind this summer. But there are various things that you can do. The shadowing is a little more complicated because a lot of medical offices, dental offices are closed. I know that the vet offices are open. They're operating under different circumstances, but they still have techs working there and still need people to help with the animals. So the pre-vets may be in better shape than the pre-meds and pre-dent students. Did I touch on everything, Enrique, or you want to throw something in there?
Yeah, and I did want to share that, it's a different world that we're in now. And so there are some new opportunities that have showed up that didn't exist just a few months ago, say even back in February. And Dr. Morales touched on several of those points yesterday during our Courage session that, telemedicine is a thing now, especially in Texas. That was something that hadn't been allowed previously. And so telemedicine really offers a lot of opportunities. I have heard some students who have been able to serve as translators via telemedicine, particularly to areas that have been hard hit by COVID-19. And, there are different services that provide that. There are also some scribing services that are able to participate remotely due to telemedicine being implemented. I think the key takeaway is that you all stay active in the search for activities. There certainly appears to be a shortage of activities, but in reality, it's just been a transition that's happened here. And this is a conversation that always happens during our annual meeting with advisors for health professions, is that shadowing activities are actually pretty rare because hospitals have regulations that they need to abide by. And this is just talking pre-COVID. Hospitals have different regulations that they need to abide by. And for those of you that have done shadowing in different office environments, you all know the paperwork that's involved with that and the indemnification forms and all that to make sure that you're able to do that. And so I think we're entering a different phase in healthcare that opens so many doors for you all to really take advantage of that. And even beyond just healthcare experiences, but volunteer experiences are very different right now than they have been in other years. And we're seeing a lot of students really engaging with that and connecting with that. So even if you are a future applicant who maybe you're a freshman right now and you want to apply to medical school down the line, and you're seeing how quickly everything's changed right now, I think it's important to stay engaged with your overall goal and really finding opportunities to exercise those skills that you really want to show the schools later down the line. Okay, we do have a few more questions that have come up, and thank you all very much for your questions. Hello, I have a question about submitting my application without an MCAT score. For this cycle, would it be beneficial to wait for the score or wait and let it update automatically? You should never, ever, with a TMDSAS application, you should never wait for your test scores, your letters of evaluation, or your transcripts to submit your application. The schools have different responses on when they'll start looking at applications, but so far we've heard that the schools will at least start putting you into their process to begin reviewing even without an MCAT DAT score and even without letters. There's so many things in your application that need to be assessed. And the sooner that you can provide the schools with your application, the sooner they can begin that process. So that way, if there are some different elements of your application, for example, an MCAT score that is still pending, once they receive that score, that's the only thing that they need to review prior to begin extending interview invites. And so if you wait until that score is there, you may be disadvantaging yourself by not providing the schools the most amount of time to review your application. So please do submit your applications, even if you don't have your MCAT scores yet. We have heard from some of the schools during the courage sessions that for those of you that are reapplicants or retaking the MCAT or the DAT, that having that older score will actually allow them to start processing your application. And as a new score comes in, they will be able to see that. So don't forget that even if you may currently or may not even have a score yet, or if you may have an older score, you're able to provide that now. And then the schools will be able to see that there's a planned test date on there, and they'll know when to expect the next test score. So please do go ahead and submit your application, even if you don't have an MCAT yet. And I think on that same topic, we do have a lot of concerns about the timeline for a lot of MCATs. I know for DAT, it doesn't seem to be as large of an issue. And since the GRE was moved to an online format, that's definitely not an issue there. But for MCAT in particular, with the test date cancellations in the spring and the new MCAT test dates and some of the changes that happened over the summer, if you have some of the later MCAT test dates, meaning, July, August, September, don't fret. Hold on to that test date. Every single one of the schools that we've talked to is holding spots for interviews, knowing that some of those test scores will not be coming in until much, much later. So don't fret, get your application in, get your secondaries in, take the Casper if you're applying to a school that has Casper. And once those test scores come in, the schools will know when they're coming in, and they'll be able to extend interviews. But I think in those scenarios, it's most important for you to actually submit your application earlier, so that the schools know that there's a test date coming and it might be one of the later ones, so they can start making more realistic allocations for how many spots to have available later in the season.
And perhaps you can take some extra practice exams to help you out with that later test date.
Yeah, maximize your time. I can tell you, every other applicant I've worked with in the past would give anything for a few extra weeks, 2 more days of MCAT prep, and take everything with that growth mindset. This is a huge opportunity for you all to have more time to study for the MCAT. Does anybody want to study for the MCAT for almost a full year at this point? Absolutely not. So make sure that you're staying sane and practicing self-care, engaging with your preparation in a manner that is conductive to you improving rather than just filling in time with MCAT prep. Please do take care of yourselves first and foremost, because this is, I think even more so this year than other years, this is a marathon. It's not a race. Okay, we have another question on here. Hello, it's nice to get the opportunity to hear you guys speak. Thank you. I have 2 questions to ask. One, what is the earliest date you can get an interview for this cycle? From some of the, go ahead, Deb.
No, go ahead. Well, I think a lot of the schools are preparing a later interview cycle simply because of the later deadline for getting in the application. So for those who would normally have a July or August interview schedule or sending out invitations, that may run into September. Yeah. But I'm assuming that the people who get their applications in early could get some very early invitation dates too. Yeah. Since most of the schools, I believe, are doing the Zoom interviews.
Right, and that's actually one of the questions that we're bringing to the schools as a group, is finding out how they'll be conducting the interviews. And Dr. Beck and I and the rest of the Texas Health Education Service team will be working on some resources to provide you all with interviewing online, and obviously we'll be reaching out to some other support out there to kind of help us with that. I think at this point, a few of us are kind of pros at Zoom meetings, and we have some things to share, but we definitely will engage with some of the schools to develop those resources. This is I say this all the time, but this is a weird year, and we're here and we're committed to helping you all be able to shine in your application and your interviews. So the second question on here is, I sent my transcript to TMDSAS back in March, and I haven't heard from, before I heard that TMDSAS wasn't requesting them. How will this affect me? It will not affect you, but please do make sure to wait until TMDSAS requests your transcripts before you send them in. If you sent in your transcript before March, it probably would have gotten rejected anyway, because it wouldn't have spring grades. And so even in a typical year, it would have gotten rejected. And so in that instance, just wait until TMDSAS request for you to submit transcripts. For some of you all who are part of Academic Fresh Start or part of a special or assured program, TMDSAS is already requesting transcripts from you. But for the large majority of the applicant pool, it will probably be quite a few months before TMDSAS starts requesting those. All right, let's check out over here. We have a question about improving GPAs. Would it be more beneficial to take post-bac courses or enroll in a master's program? If I'm 4 years removed from undergrad and I'm trying to decide which direction to go in. I'm going to completely defer to you, Dr. Beck.
Thank you, Enrique. You could go several different ways with this, as you may have already looked been looking into those different ways you can enhance your GPA. Certainly the post-bac master's programs can be very valuable. And I think that the med schools and dental schools assess great value to those programs because you're already taking medical courses. So if you're trying to prove to them that you can do the work and that there may have been extenuating circumstances in your undergraduate record, perhaps you had an illness or a family member had an illness or there was an accident or for whatever reason, and that you need to prove that you can do the more difficult medical or dental school classes. Certainly a master's program, master's post-bac program, there in the state of Texas, there are 1 and 2-year programs available to you. Now, on the other hand, you would ask, do I just go back to school and take upper level biology and chemistry courses to prove that I can improve my GPA that way? And you can certainly do that as well. And there are 2 ways to do that. You can put off your graduation, and that goes into your undergraduate assessment, right, Enrique? And yes. As long as it's before you graduate. Mm-hmm. And then if you want to go ahead and graduate, as maybe your folks would like for you to do, you can go back and take those courses as a non-degree seeking student or seeking a second bachelor's. You can do that, but the medical and dental schools really don't require that or look for that, but they are looking for your performance and how it's improved in those upper level biology and chemistry courses. Doesn't have to be biology, all biology and chemistry, but it needs to be some challenging courses. It could be upper level psychology, but they want to see some of the hard sciences in there.
Yeah.
Enrique?
I think the question here really comes down to academic rigor, which is what the school call it. Professional school is hard academically. We've all heard the analogies of drinking water from a fire hydrant, and particularly for dental applicants, the schools want to see you taking rigorous coursework right up to the point of matriculation. And so my recommendation to you is to really take a look at everything that you would have in your preparation and your, what we would call an application. Take a look at what it looks like so far. Did you do really well in your classes? Did you improve over time? Did you take difficult courses and perform well in them? Did you do exceptionally well in your tests, your MCAT, your entrance exams, MCAT, DAT, or GRE? And I think if you have any doubts there, then you might want to consider opportunities for you to show that you're able to handle academic rigor. And so in those situations, you have the question of, do I pursue a post-bac, whether it be a formal or DIY post-bac, or do I pursue a graduate opportunity? And I think the question there is, do you want to do GPA repair, or do you just want to show aptitude in the higher sciences? If you want to try some GPA repair, then you might opt for a post-bac program. And not to reduce these programs to just, GPA repair. They are really rigorous, and they are extremely beneficial to a lot of students who need more structure to prepare. Because a lot of times they will build in, MCAT preparation, they'll build in some advising resources. We have some phenomenal programs here in the state of Texas and abroad, meaning outside of Texas, that really provide some great benefits to students. And that might actually be a great option for somebody who may be removed a few years from their academic life. If you're a second career person and now you want to pursue this pathway, then maybe one of those post-bac programs might be a great option for you. But if you are somebody who perhaps may be more interested in research or being a little bit more competitive, maybe a graduate program might be more beneficial to you. Are either of those required? No, absolutely not. But it ultimately comes down to your preparation. You're not trying to impress anybody here. You're trying to become the best healthcare provider that you can. And your job is to show how these different experiences and activities have really influenced you. And your job is to prove to the school or show the schools why they're going to make you a bit more efficient healthcare provider. We can say that about everything else in your application. So if it's something that's important for you in your development, go for it. But if you have any concerns about it, do your research. Maybe talk to the admissions officers at both the post-bac program and a graduate program. With some of the schools that we've talked to, we've discussed public health. We've discussed graduate programs. Perhaps for a dental student, that year may look like taking a 1 or 2 year MBA program because you know that you're going to be running a private practice later down the line. And if that's something that's important to you, it'll become important to the schools. So really just sit back and really think about what you want to do and what you want to show in your application, because that's what's going to be important to you. And the schools will see the excitement behind that and the thought process that went into that. And that's what's important. All right. Let's see. We're just on our soapboxes today.
Apparently.
Yeah. So we are going to post a little bit later on our page. We're curious to see what kind of activities y'all have been involved in this summer, especially with the changes that have happened due to COVID-19. So please, once you see that post come up, it should be this afternoon, share with us what activities you're engaged in, because it'll be really interesting to see the diversity of the different activities. And it'll be really helpful for those who are kind of planning out what they want the rest of their summer to look like, who may have to be scrambling to find new activities. We're all here to collaborate and help each other out. Another thing that I know Dr. Beck wanted to discuss is the essays, and in particular, the issue of how COVID has affected you. COVID's affected us all. So would you mind walking us through how somebody
Yeah, I'm hearing from some students, actually reading a little bit about those experiences that people are writing about. And just keep in mind, if you want to write about COVID and how it has affected you, it needs to be a really personal experience, and not just that you've been sheltering in place and can't get out, and it's really affecting your mental health, as it is all of us. But I think keep in mind that there will be thousands of applications, and if a lot of people are writing about their COVID experience, you don't want the admission committee to say, oh no, I can't read another essay about COVID, So make sure if it, maybe you had COVID or one of your family members had COVID, or maybe you were a scribe or a CNA, and had some very personal experiences related to COVID, perhaps then include an essay on that. But otherwise, think about if you really want to write an essay about something that everyone's writing about, because you do want to stand out. Now, in the secondaries, there may be some of the schools that are asking you to write a short essay about COVID and your experience. So keep in mind that you may still have that opportunity to share how your experiences with COVID have come about and how you've dealt with
it. If I could jump in on that.
Yes.
It's part of a larger conversation that a lot of students should have with their advisors. Because it's not just about COVID. We all have very personal stories. And I mean, I'm not on this career path to becoming a healthcare professional, but I have very personal stories that drove me to this career path. And that made me want to, have this type of career. And it's not necessarily all good, but what's important is that I'm able to discuss what it is that I took away from those experiences and why they're important for me as a professional now. And so it's important for you all to really think about these different external things that are affecting you in your life and your desire to pursue this career, and really assess what it is that you want to get out of it and why that external influence is important to your development. So as we mentioned, everybody's been affected by COVID in one way or another. And the same thing could be said about, I've read several essays about very personal experiences with doctors that may not have been the most ethical or may not have been the most engaging with people. And that was the moment that sparked why somebody wanted to pursue a career in medicine. And that's fantastic that they're able to recognize that. But when the essay becomes manifesto against bad doctors and how this person is going to transform the entire medical field, it just becomes, unfortunately becomes very fictional, when this should be an opportunity for you to discuss why that experience is important for your development, and why, because of that experience, you have different things that you've listed out in your application. The essays are an opportunity for the schools to get to know you. And sometimes we have stories that may not be the most pleasant that drove us to a place. And in those instances, if you can clearly discuss why that story is relevant to your journey, then you should definitely include it. But be very careful that it's not just an opportunity for you to vent. The admissions committees are not there for you to vent. They're there to figure out whether or not you're a good fit for their school.
Yeah, I'll add that, as Enrique alluded to, that everything in there should be something positive that you've learned. And again, as Enrique was saying, if you've had a negative experience, it's easy to write negatively about it. But on the other hand, you can turn that around and say what you learned from it and how you've grown from that experience and increased your resilience and your insight into something that happened to you.
Yeah. All right. Well, we have a few minutes left in this session. So we're here to answer your questions. If you have any, please feel free to share them with us. We do want to go over another section of the TMDSAS website with you all. And this is the activities that you can update after you submit your application. So we're going to go ahead and go to TMDSAS. And this is important for you all to know. Either medical, dental, or veterinary, the pathway is exactly the same for each of them. So we're going to pick on the dental applicants right now. Each one of them has a different, has the exact same menu. So you click on next steps after submission. And then after submission, making changes to your application post-submission. So this section will actually show you each one of the different sections of the TMDSAS application, and it'll show you which sections can be updated and which ones cannot. So for you to be able to update on your end, you're able to update your colleges attended, coursework, contact info, demographic info, high school, letters of evaluation. If you have an evaluator who had to drop out and you need to update that, you can update that. If it's a change that has to be reported to TMDSAS, such as a disciplinary action or felonies and misdemeanors, that must be reported to TMDSAS. After submitting, you cannot update any of the activity sections of community service, employment, planned activities, research. So if there are any changes that happen with your planned activities or current activities, just kind of keep a list that you can bring with you during an interview day. And then the schools, you'll be able to share that with the schools and they can add that as a supplement to the interview or to your application. And so this section will line out, exactly what can or cannot be updated. So for example, here for coursework, Applicants can make limited changes to this section following submission. TMDSAS will make changes that are required during the application processing and following the completion of planned coursework. So what you have to do is log into the application to make the changes. For any change that you are unable to make, send TMDSAS an internal message to detail that request. So I know this is an area that causes a lot of discussion in the online communities. And so I wanted to make sure that you all were aware that there are some sections of the application that you can update almost entirely on your own. There are some sections that can be updated, but you need to request TMDSAS to assist you with that. And there's some sections that just will not be updated at all. And that would include like the essay section. So please be careful before you hit submit. Make sure that you go through your entire application and make sure that every single T is slashed and I is dotted and J's are dotted. Everything is covered, because once you hit submit, there are some things that just will not be able to change. And it's very important that you take the time to review the application in full. Okay, another thing that we want to discuss is the upcoming Courage sessions that we will be having. Next Wednesday, we're really excited to welcome some other office colleagues just down the hall from where we typically have our office. We're going to be joined by the Joint Admission Medical Program. That's going to be Mr. Paul Hermesmeyer and Dr. Joel Robles. And they're going to discuss with us the benefits of the program. For those of you who may be in high school or may know somebody who is in high school or starting a freshman year and is interested in pursuing a career in medicine, this is a fantastic program, and we really encourage you to join us so that you can take a look at how that program has been affected by COVID-19, but also the benefits that the program provides to its students. So that will be on Wednesday of next week at 1 p.m. And then on Thursday, we're really excited to welcome the University of North Texas Health Science Center, Texas College of Osteopathic Medicine, colloquially known as TCOM. We are really excited because that's the first osteopathic medicine that we'll be welcoming to the Courage sessions. We've had previous podcast episodes with Dr. Mike Kennedy, and he'll be the one joining us on Thursday. And so we're excited to discuss the philosophy of allopathic versus osteopathic schools, what that looks like in practice, and also exploring how that school has been affected by COVID-19. We'll discuss the typical questions of how interviews will be conducted. They are one of the schools that does MMI, so it'll be interesting to hear how MMIs will be transitioning during this period. And then the week after that, we'll be taking a short break. But following that, we are really pleased to welcome some more of the schools, including the Dell Medical School, to discuss what they'll be doing. The Dell Medical School actually just graduated its first class, as well as UTRGV. So it's really exciting to hear those developments and hearing how the theory of those schools kind of came to play over the years. So please do join us. We're continuing the Courage Sessions series. Hopefully they're helpful to you all. We do intend that these be opportunities for you to ask questions and get some immediate answers, but more than anything, to really feel encouraged for this application session, for this application process, because this is a weird year, and we want to make sure that you all stay hungry for this career, because it's a very noble career, and we want to make sure that you don't find obstacles, but rather opportunities along the way. I also am excited to announce that TMDSAS will be doing what they call TMDSAS office hours, and they'll be on Tuesday at 1 p.m. on the TMDSAS page. So join us back here where Alana Edwards and Nicole Castillo will be joining together to address your questions about the application. So bring any and all questions that you have about the TMDSAS application to them on Tuesday at 1 p.m. and they'll be glad to address them. And hopefully that will give you all sufficient opportunity to make sure that you get your applications in a timely manner, because we do want to make sure that you don't get stuck behind the typical summer push, because that's usually when we get the most amount of applicants. I also did want to share with you all that We're excited to see that the applications that are coming into TMDSAS have actually increased significantly over last year. We've had a pretty significant jump in both medical and dental applicants this year. For veterinary applicants, there isn't necessarily an incentive for you to submit earlier, but with this year, we are welcoming the new Texas Tech Health Sciences Center. Let me see if I can get this right. College of Veterinary Medicine. They are up in Amarillo. We will have them for the courage sessions, but it might not be till later in the summer. We still have quite a few schools to go through, and we are excited to welcome them. So for you veterinary applicants, we haven't forgotten about you. We know that you have some questions on there, but we do also recognize that those applications may not be coming in quite just yet. So before we end this courage session, I did want to put both Deb and I on the spot to offer some encouragement based off of what we've heard from our member institutions and what we're experiencing around the TMDSAS office and the Texas Health Education Service.
Yeah, I would just, I recently was reading a book about Churchill, and for those who aren't familiar with World War II, he was the Prime Minister of Great Britain during the bombing of the whole country. And he was always giving inspirational talks to his people and to encourage them to continue life as they knew it before the bombing started and before they were under that kind of pressure. And one of the memorable things, which is very short, that he said, and everybody can remember this, and he said, never, never, never give up. So tomorrow morning when you get up and you think, I can't study another day for the DAT or the MCAT or the GRE, yeah, you can. Just remember not to give up and to give it another day and another try. Hang in there.
It'll be worth it. I find it so serendipitous that you and I pulled similar quotes.
No.
But I'm a huge, I won't say fan, but I really appreciate the work that Dr. Brene Brown puts out in terms of engaging vulnerably and sharing empathy with others, particularly during difficult times. I think it's been a large driving factor for me personally, especially using these courage sessions. You all have seen how some of the schools are, sharing some vulnerability, that things are not quite where we'd like for them to be. We still aren't sure how some interviews will be conducted. We aren't sure how some things may be working. Whereas other times we have very clear feedback from the schools, like how quickly the schools came together to say, if your classes move to pass fail, then we will accept them. Or if your classes are online only, we will accept them. And so there are some things that we can move quickly on, and there are other things that need to be a little, resolved a little bit slower. But on your end as students, I think what's important to know is that if this is something that's important to you, if this is a pathway that you want to pursue, we're here to help you. And the quote that I pulled is from Dr. Brown's, "The truth about who we are in our lives is in our hearts. Our call to courage is to protect our wild heart against constant evaluation, especially our own. No one belongs here more than you." So if you feel that you belong here, there is no force, there is no virus, there is no obstacle in your way from getting you where you need to go. So have courage and keep pushing forward. Just as Dr. Beck just mentioned, we're all here for you. And we are very excited to be here and be able to continue to engage with you all week after week through these courage sessions. So we hope that these are helpful to you all. And on behalf of the Texas Health Education Service, the TMDSAS, we'd like to wish you all the best of luck have courage, and we will see you next week. Thank you.
Take care.